Welcome to Connections, bringing together King's Business School's sharpest minds with first-hand insight from leaders in the world of business, public service, science and beyond.
Hello everyone, and welcome to the podcast series of King's Business School. I am Sotiris Vanderos, reader in health economics at King's Business School, and it's a pleasure today to host Mauricio Avendano, who is Professor of Public Policy and Global Health and Head of the Department of Global Health and Social Medicine at King's College London. Hello, Mauricio.
Hello, Sotiris, and thank you very much for inviting me. It's really a pleasure to be here and speak with you.
Always a pleasure. So we're in the middle of a pandemic, which has changed everyone's lives and pretty much every aspect of society for the time being. And I was wondering, this is likely to, well, it's already caused a lot of financial problems. Many countries are in a recession, if not all countries. Unemployment is increasing. So we're in the middle of a health crisis, which is triggering a financial crisis as well. And a lot of your work relates to social conditions and economic conditions and health. So I was wondering, what would you expect to see in terms of unintended, or not unintended, like spillover effects of the crisis and the pandemic on other health problems that may occur sooner or later, like in the medium term or the long term?
Yeah, thank you, Sotiris. Yeah, we have known for a long time that social changes and profound social changes are important for health, and this is what we call in the field of global health the social determinants of health, which is now also a pillar of the WHO. If you look at the structure of the WHO, it has a really big part dedicated to understanding the social determinants of health. So we've known for a long time that things like unemployment, things like income losses, changes in people's families, their social contact, social isolation, can potentially impact people's health. And what we've seen with the pandemic are very profound transitions in areas of people work, their relationships to their families, how often they see each other, also things more concretely related to Covid-19, such as bereavement and so on. So it is likely that this crisis triggers important social changes with consequences to health. Now, one of the most important changes that we've seen, of course, relates to changes in the economy and changes and the sort of, let's say, recession or period of economic decline that we see as a result of COVID-19. And we know also from much research that the changes in economic conditions can have important consequences for physical health. We know that, for example, job loss and unemployment is associated with increased risk of heart disease, but also increased risk of depression, increased risk of suicide, and so on. Now, what's really more difficult to tell this is how this particular crisis that we're experiencing in relation to COVID-19 will actually impact health. And as you know, Sotiris, there is a large set of studies, for example, showing that actually sometimes recessions, periods of economic decline, can actually have unexpected effects on mortality in the sense that they may actually lead to reductions in mortality and improvements in health because people change their behaviors in unexpected ways, or because there are changes that happen that we did not expect. So, for example, people might smoke less, they may be actually having a healthier lifestyle, they may be actually drink less. And so there may be ways in which the changes associated more with the social distancing policies might have actually different effects on health. So I think just to sort of introduce that area, sort of there may be complex processes going on, and it's not so simple as saying, yes, this recession will be bad for health. I think it's a complex set of changes that will happen, and the challenge is to kind of understand how each of these changes might have implications for health.
Wonderful, thank you. And you mentioned that. Well, we've seen in the literature that in some cases, recessions have been bad for your health. Other studies have shown a positive relationship between recessions and health. So it seems that depending on the particular crisis and the particular type of crisis and the particular setting and a particular country, results and the impact of recessions on physical health seems to be different, while the effect on mental health usually tends to be negative. Also, as you know, we get more and more evidence. There does indeed seems to be a differential effect on physical health. So why would you think that different recessions have different physical health outcomes on one hand, and also why do you think that while we see these differences in physical health outcomes, mental health seems to consistently be negatively affected?
That's right. Yeah, that's right. So the effects of recessions on physical health has been explored for really over a century maybe. But one of the major studies was indeed a study by Christopher Rahn, which showed that actually periods of economic decline led to declines in mortality. And part of the reason that study sort of was exploring as a potential explanation is changes in, as I was saying, reductions in the amount of alcohol consumed, changes in smoking, but more generally the fact that work, in some ways you can consider work as being taxing to your health. You invest as much as you invest more on your work, you also maybe investing less on your health. The opportunity cost of time might change, which means you have maybe less time to go to the doctor and in general, do physical activity or anything that might be health improving. So for physical health, is as always very difficult to predict how different changes in the economy might impact health. Now, for mental health, the story is quite different because we've known for a long time that changes in employment and employment insecurity have very strong negative effects on both depressive symptoms and anxiety, and in some more special cases, in more serious forms of mental illness. In some ways, one hypothesis that we might expect is that many of the uncertainties associated with the future of the economy as a result of the changes in employment will actually lead to higher rates of depression and anxiety. However, again, every crisis is different, and one of the special aspects of this crisis is that there has been a particular policy response, a social policy response, and that is quite different from other occasions. So, to put the case of the UK, for example, the introduction of the furlough scheme, in which governments basically covered a fraction of people's salaries, essentially introduced a new category of employment that is being furloughed. And we do not understand yet very well whether this will be positive or negative for health, or whether it actually prevents many of the negative effects that we will otherwise see if these groups actually would have become unemployed. So I think every crisis has a different response. Different countries respond differently to crisis, either by increasing social spending or by going through austerity measures. There is a general feeling that austerity measures might have negative effects on mental health, less clearly on physical health again. And so, part of this is sort of trying to understand how different policy responses might have different effects on health.
Thank you. And already before the COVID pandemic struck, we already had quite a major opioid problem in the US, which had its root, of course, in fraudulent claims by the manufacturers downplaying addictive issues related to those drugs. So there was quite a big role of the pharmaceutical industry. But at the same time, a number of studies have shown that part of the problem was also due, or at least the problem became even bigger for, when socioeconomic problems were greater. So factory closure, higher unemployment rates were associated with greater opioid use. Also in the UK, we've had an upward trend in opioid use over the past years. Do you think that the COVID pandemic and the associated financial problems can lead to an even worse opioid problem, both in Europe and in the US?
That's a really interesting question that I hadn't thought about. Indeed, this sort of opioid crisis sort of has been sort of labeled as a kind of trends of despair in the US, sort of as potentially reflecting the potential effects of economic decline in some areas of the US, especially among middle-class American families. Now, I think these are interesting hypotheses, but I think at the moment the evidence is is quite mixed and not exactly sort of pointing always into the direction that that is sort of the only or even the main explanation. It is clear that there are certain groups and especially geographical areas in the US, for example, that have been more vulnerable to the opioid epidemic, and it is likely that that has to do partly with social and economic conditions, but I think there is likely a more complex story related to, as you know better than me, the regulation of pharmaceuticals as well, and many things that have to come together for this to happen. Now, whether we're going to see this with the case of COVID-19, that's an interesting question and difficult to give an answer. Again, as I was saying, it very much depends on the government response and how people's behavior changes. I think the so-called trends of despair in relation to the opioid epidemic relates to longer-term trends that have been happening for a long time, and a kind of hopelessness that certain families and people have in sort of areas in the US and maybe increasingly in the UK that may lead them into a certain sort of pathway. But it is more difficult to say whether this COVID-19, which is a very sharp crisis, sort of very sharp changes, where there's been a sort of different social policy response, how that will lead to sort of the use of opioids and so on. So far, the studies, I work at the Center for Society and Mental Health of King's, which has done a review on the impact of COVID-19 on mental health. And so far, the evidence is really mixed on the impact of these changes on people's mental health. There seems to be sort of some evidence that it may have impacted younger people, but the impacts on older people are actually less clear. There isn't really a picture that one would say there is an epidemic of mental health, even so some studies might claim that there isn't really sort of such epidemic of mental health problems yet emerging as such. I think we really have to see how this pans out in the long term, but it's important not to sort of jump to conclusions on how mental health will react.
That's good to know, because it's very early in the pandemic, and of course we can make some assumptions and some hypotheses based on previous financial crises and previous pandemics. But indeed, it's very early and we don't have much data. So any new information and any new research can be very, very useful. For example, we've even seen some reduction in other types of mortality. For example, motor vehicle collisions, like car crashes, have gone down. Deaths from car crashes have gone down in some countries. So there's a lot of bad news about people not receiving treatment or delayed diagnoses, cancer patients having delayed treatment, and lots of other things that can have disastrous effects on health. But at the same time, there are also some positive spillover effects, such as, for example, reduced mortality in car crashes. So let's see what the data will show when these data become available. You also mentioned safety nets early on. So what sort of safety nets tend to be more effective when it comes to the protective role against mental health problems?
Thank you, Sotiris. I think, again, programs, there are different kinds of programs that countries have, and they are very, they vary a lot from country to country. So most countries, for example, in Europe, which will have an unemployment insurance program that provides sort of some kind of cash benefits in periods of unemployment spells. Those programs, we've done some research with some colleagues at the LSE looking at the impact of, for example, unemployment benefit programs. And it's interesting that looking at how different states in the United States have reformed the program so that the level of generosity of some states is much higher than other states, and this has varied over time. What we find is that more generous unemployment benefits can contribute to reduce suicide rates. Now, that doesn't mean that this is the most cost-effective way. So to reduce suicide, actually, you will need to invest a lot in unemployment benefits to reduce suicide, but it does sort of give us a general picture that the level of generosity of unemployment benefits might actually help reducing suicide rates. Now, we've also done sort of some work looking at one of the main social protection programs that has risen in the last couple of decades in low and middle income countries are conditional cash transfer programs. And we have a project looking at 6 countries across Latin America and Africa looking at the impact of this, actually of both conditional and unconditional cash transfer programs. And what we find, and there was a paper recently in Science looking at this by colleagues at Harvard and MIT, looking at the impact of these programs on mental health. And what it suggests is that these social protection programs can actually reduce the rates of mental health programs, especially for adults. And we're trying to establish to what extent these programs may also reduce the rates of depression and anxiety for young people. And again, the difficulty here is that establishing that these programs are causally related to mental health is really challenging, but the preliminary results do suggest that the expansion of social protection, conditional cash transfer programs in many Latin American countries, and the unconditional program in South Africa has contributed to some extent to reduce rates of depression and anxiety in young people, and that the longer people and children and young people were exposed to these programs, the lower the rates it is that they develop mental health programs. So there's some picture that starts to emerge that some level of social protection when you're growing up, when you're an adolescent and go through all these crises, these countries have experienced major crises in the last 2 decades, might have a potential to reduce rates of mental health problems. So these are, a couple of examples of particular programs that might have impacts on mental health, and that might sometimes help or might sometimes have small but perhaps important population level effects on mental health.
Mauricio, thank you very much for joining us today and for the very interesting conversation.
Thank you very much, Sotiris, and it's been really interesting speaking to you.
Mauricio Avendano Pabon is Professor of Public Policy and Global Health at King's College London and Head of the Department of Global Health and Social Medicine. Thank you everyone for joining us today. Bye-bye.
Thanks for listening to Connections. Subscribe for more insights into the issues shaping business, the economy, and society.